Hi, this is Dr. John Pelto. I want to go over plantar plate tears today. A plantar plate is in the bottom, usually of one of the metatarsal heads, and it's caused by a cocked up toe, or either the cocked up toe happened after the plantar plate tear. So let's go a little bit into the anatomy. Usually you see a kind of a toe drifting either to one side or the other. Let's look at the anatomy. The collateral ligaments are on the side of a joint. Usually the second toe joint is really common for this. And if one of these collateral ligaments may become injured, or there may be a tear in this thing called the plantar plate, which is this little green aspect of the anatomy that actually holds down the base of the second toe. And when there's a little tear, it causes, wherever there's a tear, it drifts to the other direction. And the only way to really determine that is intraoperatively. When you open up the joint, you can determine if it's torn by putting a little freer elevator in there. If you look at the side, you can see that the plantar plate is right down here, and sometimes there's a tear and it causes the joint to kind of pop up. And initially it starts to be painful, but later on it may not even be that painful if there's no plantar plate at all. What it's not, you have to be careful. It's not a stress fracture. It's not something called avascular necrosis of the metatarsal head. It's not simply just pain under the bottom with no change in the toe. And if there's only pain, it could be something called metatarsalgia. It could be something called capsulitis. But a plantar plate tear is usually right around here where you push in. And there's a specific test that we do called the Lockman Test, where you grab the toe and lift it up. And if it hurts when you lift it up, it may be a plantar plate tear. If it totally lifts up really high, it may be totally torn and not painful anymore. Sometimes an MRI can help you, or doing an injection into the joint with some radioactive dye and then doing an X-ray or an MRI as well. Plain X-rays really aren't going to help you that much, except you can see the anatomy. Usually on the anatomy, you may see a longer second metatarsal head compared to the first metatarsal head. The different types of treatments, usually in the office, we try first of all to tape the area down. That's going to reduce some of the stress and strain. You can either use regular tape on the toe, or you can use a special splint called a Bunion splint. Sometimes you can try an orthotic with a cutout under that area or metatarsal pad. That may help some people, or a walking boot to really reduce the stress on the front of the foot. Reducing any kneeling, going on ladders, things like that can help. Cortisone injection is kind of iffy. If the joint is already inflamed and painful and you're thinking it's a plantar plate tear, if you do that, it can make and even weaken things more and cause the hammer toe to go up more. If you're only concerned about a joint inflammation, maybe metatarsalgia or capsulitis, you can try that as well. Those are some conservative treatments. And if that doesn't work, one of the last steps is to do the surgery. This is one type of the surgery that can be used, but basically in every type of surgery, you want to evaluate the plantar plate. You can see it's torn here. It's supposed to be attaching right here, and it's torn. So what you go in is you actually complete the tear and take some suture and suture it into the base of this bone with a couple of drill holes, and you tie things down to bring it down. And then you have to repair this bone. You have to shift the bone back to get visualization unless you go from the bottom of the foot. And sometimes this can be done. If it's totally torn, there's nothing to you can't find it because it gets retracted back. You may have to do a tendon transfer. You actually take the tendon on the bottom and flip it up top to pull the toe down to help bring down that hammer toe as well, along with fusing this toe. So I hope you found this helpful to learn a little bit more about plantar plate tears.